지치면 안 되는데 그게 더 이상해 마지막이 들리는 이 에어컨소리 네가 내게 없으면 난 정말 무너질 것 같아 함께 웃겨요 함께 울까요 이 단순한 감정들이 내겐 전부였나 봐
surga itu kamu surga itu kamu surga itu kamu surga itu kamu duniawi juga kamu sumpah mati yang ku mau cuma sama kamu
surga itu kamu duniaku penuh kamu
kita bikin mesra sampai turun panas hati dingin
I got to have you back
No, I believe 자꾸 찾아 헤매이던 그대와 my 내 사랑이 my only love my only one.
Assalamualaikum everyone. We are from TSP7 gentlemen will presenting infertility in Malaysia. A case that growing concern in Malaysia. Infertility is a growing concern in Malaysia, impacting an estimated 10 to 15% of couples of reproductive ages. This condition can result from a variety of factors, including lifestyle changes, delayed childbearing, and underlying health issues such as polycystic ovary syndrome (PCOS) and male infertility. The rising incidence has led to increased demand for fertility treatments and assisted reproductive technologies (ART) such as in vitro fertilization.
This is the current data about fertility in Malaysia. The graph shows a highly troubling drop in Malaysian fertility rates from 2012 to 2022. In 2022, the total fertility rate in Malaysia was approximately 1.6 births per woman aged 15 to 49 years. The total fertility rate refers to the average number of children which will be born to a woman during their reproductive period. This will worsen if not stop and will continue in the future. So, what is infertility? Infertility is the inability to achieve pregnancy after 12 months or more of regular, unprotected sexual intercourse, or after 6 months if the woman is older than 35.
The factors that led to infertility problems. What is the factors of infertility in men? One of the factors is we can see in the terms of medical condition. One of it is testicular issues. Testicular issues is injury or disease affecting the testicles can reduce the sperm production and quality. For example, infections can lead to scarring and blockages in the reproductive tract, reducing sperm production and transport. And the second factors is we can see in the terms of lifestyle factors. Smoking has been linked to decreased sperm quality and quantity. The factors of infertility in female. In terms of medical condition, one of it is thyroid dysfunction. Thyroid dysfunction is both hyperthyroidism and hypothyroidism can interfere with the menstrual cycle and ovulation. And the second one is uterine anomalies. Uterine anomalies is structural abnormalities of the uterus which may be congenital or acquired, affecting implantation or increasing the risk of miscarriage. So, what about the factors of infertility for both men and female? Okay. In terms of medical condition, one of it is diabetes. Poorly managed diabetes can affect hormone levels and reproductive function in both men and women due to imbalanced hormone. In the terms of age, fertility naturally declines with age. Women experience a significant drop in fertility in their mid-30s and beyond, while men also face a decrease in sperm quality and quantity as they age.
So, the treatment that we choose is controlled ovarian hyperstimulation (COH). Controlled ovarian hyperstimulation (COH) is a medical procedure used to stimulate the ovaries to produce multiple eggs during a single menstrual cycle. This is typically achieved through the administration of fertility medications, which enhance the body's natural reproductive hormones. COH is a common step in assisted reproductive technologies such as in vitro fertilization (IVF), aiming to increase the chances of successful fertilization and pregnancy.
Procedure of controlled ovarian hyperstimulation (COH). This procedure involves 7 steps. The first step is initial assessment. Before starting COH, a doctor performs an evaluation including blood tests and an ultrasound to check the woman's ovarian reserve and overall health. The next step is medication protocol. The woman starts hormone medication, usually injectable gonadotropins, to stimulate her ovaries to produce multiple eggs. Sometimes oral medications like clomiphene citrate are used. The third step is monitoring. Throughout the stimulation phase, the woman undergoes regular blood tests and ultrasounds to monitor the growth and the development of the ovarian follicles, which contain the eggs. The next step is trigger shot. Once the follicles have reached the desired size, a trigger shot of human chorionic gonadotropin (HCG) or a similar hormone is given to induce final maturation of the eggs. The next steps involve egg retrieval. About 34 to 36 hours after the trigger shot, the eggs are retrieved from the ovaries using a minor surgical procedure called T-ultrasound aspiration. This is usually done under sedation. Next, fertilization and embryo development. The retrieved eggs are then fertilized with sperm in a laboratory as in IVF and monitored as they develop into embryos. The last step is embryo transfer. A few days later, one or more embryos are transferred into the woman's uterus, or they may be frozen for future use.
Ways to increase infertility. But first, maintain a healthy diet and weight. A balanced diet rich in nutrients can significantly impact fertility. Essential nutrients like folic acid, iron, zinc, and omega-3 fatty acids are crucial for reproductive health. Next, manage stress levels. Chronic stress can negatively affect fertility by interfering with the hormonal balance necessary for ovulation and sperm production. Next, avoid smoking and limit alcohol consumption. Smoking can damage the DNA in sperm and eggs, reduce ovarian reserve, and affect the health of the fallopian tubes.
So, the conclusion is controlled ovarian hyperstimulation is a cornerstone of modern fertility treatments, offering significant benefits in terms of increasing the likelihood of pregnancy for individuals and couples facing infertility. While it presents certain risks and challenges, ongoing advancements and personalized approaches continue to enhance its safety and efficiency. Careful management, patient education, and support are crucial to optimizing outcomes and minimizing potential adverse effects.
Related Quranic verse, Allah has mentioned in Surah An-Nisa, verse 29, "You who believe do not wrongfully consume each other's wealth, but trade by mutual consent. Do not kill each other, for God is merciful to you." This verse is interpreted to mean that preserving life and health is essential and permissible within Islamic teachings. Seeking medical treatment, including fertility treatments like COH, aligns with the principle as it aims to address infertility, a health issue affecting many couples.